Hi, I'm John Hovanesian. Dexycu is a single-dose, sustained-release intracameral steroid that's injected to treat postoperative inflammation. Placing it inside the eye is best done through the main cataract incision, going somewhat parallel to the edge of the iris and painting it underneath the iris peripherally, under the iris root, in the ciliary space. It's best done at the end of surgery. And if you're going to hydrate the wound after you place your Dexycu, do so carefully so that you don't remove the Dexycu, flushing it from the eye. Occasionally, when you're putting Dexycu inside the ciliary sulcus, a small amount of it at the end of the injection will find its way in the anterior chamber, usually by sticking to the cannula. You can either burp that out of the eye or remove it. If you depress the lens implant posteriorly and soften the eye, it's going to be very difficult to get Dexycu to stay in the ciliary sulcus, so try to avoid doing that. When injecting Dexycu, try not to approach the pupil margin perpendicularly and try not to hold the cannula still when you inject, because the ball of Dexycu will move into the anterior chamber, particularly if there are air bubbles in it. Air bubbles tend to stick to the Dexycu and carry it into the anterior chamber, creating a bigger problem for you. Here's another case where Dexycu is properly placed into the ciliary sulcus, but a small amount of the Dexycu at the very end of the injection ends up in the anterior chamber. These small bubbles will be well tolerated. They'll settle into the far inferior angle, usually not causing any significant corneal edema or other problems. But ideally, you'll get all the Dexycu into the ciliary sulcus by placing, again, parallel to the edge of the iris or somewhat tangentially, painting like placing toothpaste on a toothbrush, the Dexycu into the ciliary sulcus, and not distorting the lens of the eye or causing major fluid shifts. Again, being very careful with hydrating the wound so you don't cause turbulent flow inside the eye to disrupt the Dexycu or to depressurize the eye. I'm John Hovanesian. Thanks for watching.